Hello everyone, you're watching Physio Classroom channel, and in the previous video we learned about how to deliver sustained glides to the cervical facet joints. In this video we are going to cover another important technique that can be utilized to improve neck range of motion and decrease pain, especially when the patient has gross restriction in the range of motion. That is, patient is unable to move the cervical spine either into flexion, extension, rotations or side flexion motion. Now in this technique, again our main aim is to improve the range of motion in the cervical facet joints, and how we are going to do it is by utilizing the transverse glide technique. So let's first understand about how we are going to deliver this joint mobilization, and then we will move on to the practical demonstration. So let's first understand what we are going to achieve by applying the transverse glide and how to apply it. So let's say, for example, we are going to work on the C5, C6 motion segment. So one thumb is going to be placed beside the C5 spinous process and the other thumb is going to be placed beside the C6 spinous process. And now we are going to apply a transverse glide in this manner so that there is distraction taking place at the bilateral facet joints of that particular motion segment. So one can easily appreciate when we apply this glide to the cervical spine, C5 towards the right and C6 towards the left, what is happening at the level of the facet joints? They are moving away from each other, increasing the motion, increasing the gap, helping in restoration of more blood flow, increased nutrition, and thereby improvement in the range of motion. Now again, what is important to note here is, while the therapist is going to deliver this glide also needs to be sustained, and then patient needs to be asked to perform the offending movements. So let's have a look. So this is how we can apply the transverse glide to the cervical spine. So let's say we want to first work on the C4, C5 motion segment. So I'm going to keep one thumb beside the C4 spinous process at least 2 to 3 centimeters away, so that I am in the laminar groove. And similarly, I'm going to keep the other thumb beside the C5 spinous process 2 to 3 centimeters away in the laminar groove. And now once I have the firm contacts, I can apply the transverse glide in this fashion. And while maintaining this glide, now the patient can be asked to perform the offending movements. Let's say, for example, flexion. Again, I need to sustain and maintain this glide along with the movements extension, rotations and side flexions. Therapist can also try to reverse the glide, that is, we can place the right thumb up beside the C4 and left thumb down beside the C5, and then go with the mobilization, sustaining the glide and then performing the offending movement by the patient. So this is how we can apply these magical glides, which can result in immediate improvements in cervical range of motion and pain. Now students can also take a note here that just by increasing the intensity of this transverse glide mobilization, we can cover multiple motion segments at the same time. So if there is severe gross restriction, the therapist can use extra force to deliver this transverse glide so that multiple facets can be mobilized at the same time, and then patient can be asked to perform the offending movements while that increased intensity of the glide is maintained. This was how we can use the transverse glides to the cervical facet joints to improve neck mobility and decrease pain in patients who come with cervical facet locking or cervical facet syndrome. I sincerely hope that the physiotherapy students, interns and young practitioners are going to get benefited from this mobilization series of the cervical spine. See you all in our next video. Till then, keep learning, keep sharing and stay connected.